Hello, 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 and welcome to another episode of Wellness Wednesday with Dr. Latoya Wells. I am here with you all again for another amazing episode. Tonight, we have a topic that I feel is very timely as we are preparing for a big holiday in a couple of days. And with that comes fun, relaxation, time off, time with friends and family for those who celebrate this holiday, and a lot of things. And so we're going to be discussing tonight summer safety. We are in summer. We have entered into summer, and with that comes a lot of positive things. There are also some things that we need to be concerned about and just to be cautious and mindful of. And so we're going to talk about a few of those things tonight. The first thing that I want to mention is safety, water safety, food safety, um, fire safety. We have big holidays that are coming up that will be involving fireworks and all the things. And we see each year the number of injuries due to fireworks and burns increase around the holiday times. So let's jump into it. Let's talk about it. And won't be here with you long tonight, just give you a little bit of information, but I feel like it's very important that we discuss this topic. And when we are looking at fire safety and burn safety, grills is one of the things. People are out grilling. It's summer. We have the nice weather. We're in Florida, except for when the weather wants to be a little bipolar. One minute it's hot, the next minute it's pouring down torrential rains. But anyhow, we see people outdoors, right? Because it's hot. People want to be outside, be with their friends and their family members. And with that, we have to be careful and be mindful and just take a few extra precautions when it comes to things, even water safety. We're seeing more people out on the water. My husband has a boat. We see an increase of individuals out on the water. And so there's a lot of things that we need to take into consideration to make sure that we are safe and those who are around us are safe as well. So when it comes to firework injuries and the numbers that we see in 2022, and I don't have statistics for most recent, but in 2022, over 10,200 injuries were treated in the United States in the emergency department because of firework injuries, due to fireworks. And most injuries involve the hands, face, and the eyes. And so if you think about it, these are some really serious areas, right? If you get injured in your face or your eyes or your hands, it can impact your overall quality of life and daily living, and could be deadly and can cause some major injuries. And so I want to make sure that we are aware of some of the do's and don'ts when it comes to fireworks safety and handling fireworks. First of all, no children should be left alone to handle fireworks by themselves. We want to make sure that you're using legal fireworks and make sure we're using them outdoors only. Last night I was watching a video on TikTok, just kind of scrolling, looking at some things, updating the page. And there was, no, it was on TV. There was, and I don't know where it was, but there was these people around the holiday that involved fireworks, and they were actually shooting the fireworks at each other. And I was like, oh my God, I hope nobody got burned or hurt during that, but we have to be mindful and have to be careful and just use some wisdom when it comes to utilizing these different activities, or when we're doing these different activities. Keep a bucket of water or hose nearby, because we don't know when something is going to catch on fire. Some areas are getting a lot of rain, but however, there are many areas that they're not getting as much rain. And so the vegetation and the grass and the trees and the shrubs are drier, and it's easier to spark a fire. If just a little flicker or a flame get on that area, it could start a fire. So make sure you have water, a hose nearby, or even a fire extinguisher. Light one firework at a time and then back away. I know we want to see the big booms and things of that nature. If you are not a professional, you haven't been professionally trained to operate and work with the fireworks, leave it to the professionals. Make sure you're using legal fireworks. Make sure you're using things that you can handle, and, just be mindful of that. Our neighborhood provides an amazing fireworks show every year. But these are people who have utilized these tools and these fireworks for years. And it's out in the open field. It's pretty safe. Haven't had anyone get injured or anything. So let's just be mindful of that. And also be mindful not just of yourselves, but others, right? Because we don't know where the fireworks are going to land. You don't know if it's a good firework or if it's defective. We just got to be careful and make sure that you're getting your fireworks from a reputable company. One, some of the don'ts. Never relight a firework that you tried to light and it didn't light up. Don't try to relight it. Don't let young children handle fireworks. I think I've already spoke to that. I can't tell you the number of times that I've seen children out on the street, out in their yard playing with fireworks. I can remember when I was younger, we used to have sparklers, and it wasn't just around the holiday. My grandmother would buy them for us, but she made sure she was out on the porch watching us play with those sparklers because they could get pretty hot. Never use fireworks while under the influence. You want to make sure that you have a clear head, that you're able to think, you're able to react quickly, because when you're under the influence, your response and your responses are delayed, and it could cause major issues if there's a delayed response to an emergency. And so some of the things we want to make sure that we have some alternatives to some of the fireworks that can cause burns. You have glow sticks, or there's public firework displays, which are much funner. And again, those are individuals who are trained to handle fireworks and can make sure that everyone is safe. And if there's an emergency, they have emergency personnel on site to help. It's important, guys. We got to make sure. I know there's a lot of people who are looking forward to a day off coming up, and there are a lot of people who are going to be engaging in use of fireworks and things of that nature. Just be careful and watch out for the kids. Want to segue into my next topic, burns and burn care, when to seek medical help. Because as I mentioned, we see an increase in burns during the summer, around the holiday times, especially the summer holidays and ones where fireworks are a big part of the activity. And another thing that we have to contend with is burns, making sure that if individuals...
AC adapter is disconnected.
Sorry about that. Trying to plug my computer in. Give me 1 second. There we go. Making sure that individuals know when to seek care, knowing the different types of burns, and if it's something that you can treat at home, or is it something that you need to go to urgent care or go to the emergency room. And so we're going to talk about burn care and when to seek medical help. There's different types and levels of burns, as I mentioned before. The first one is a first-degree burn, and that's where it's red and it's painful. It's, you touch something hot and that area is red, almost like a sunburn. The second level is a second-degree burn, and this is where you have blisters, where the skin begins to blister, and there's some severe swelling and redness. So first degree, there's no blistering. It is red, it is painful, but there's no blistering. Then we go to the second degree. That's where we see blistering, severe redness, and then swelling. Third degree is where there's white, charred skin, there's numbness. That is a medical emergency. And if you're not sure what level of burn that you have, go seek help. Go to urgent care. Make sure that you're getting that area checked out. It is possible to have multiple degrees burn on one body part, or someone can get multiple levels of burns depending on what they've come in contact with, the degree of which, and how long they've been in contact with that item or that firework or what have you, or fire or what have you. I want to say exposure. What to do immediately after you've been burned. I know there's a lot of myths, old wives' tales. Our grandmas taught us things. I can remember being told to put some butter on it. We don't want to put butter. We're cooking the butter at this point, right? Because the skin is hot and it's not really going to help. It's going to make it worse. So one of the things you want to do immediately after you have been burned or someone else has been burned, you want to stop the burn source. So if it's a fire, put the fire out. You want to cool the area with lukewarm water for about 10 to 15 minutes. And then you want to cover it with a clean non-stick dressing or gauze. Nothing that's going to stick to the area, because if it sticks, when you pull that bandage off, it's going to pull that layer of skin off. And as we know, the skin is our largest organ on our body. And anytime there is a disruption in the skin, then we are put at higher risk for developing infection, things of that nature. So we want to make sure that if the skin is intact, that we're keeping it intact. Avoid butter, ointment, or ice. And I know we want to put ice on those burns. I myself have done it. I've burnt my hand cooking and I immediately go and get ice. And it just does not, it doesn't help. Running under lukewarm water for about 10 to 15 minutes will help. It hurts and it burns like I don't know what, but it will help versus putting butter, ice, or ointment. There are some ointments that are specific for burns. You can try those. I know there's a Neosporin burn or pain that may help. It has some medication in it that helps with the burn. And there's some burn ointments that you can use as long as they are specifically for burns. When do you want to seek medical care? If the burns are larger than 3 inches, if it's on your face, your hands, your feet, or the genital, you want to go in and get help. If there's any sign of infection, such as pus, odor, increased redness, that means you've gotten burned a couple days ago or maybe a week ago, and now all of a sudden you're starting to see these potential signs of infection. You want to make sure that you go in and get help. And if the pain is uncontrollable or the person is under the age of 5 or over the age of 60, we want to take those individuals in to seek help, to get medical care. We want to remind you that wherever you go, whether it's urgent care or emergency room, you want to make sure that you're able to tell them the type of object or the type of fire. If it was a firework, if it was, something caught on fire, if it was an iron, what have you, what was the source of the burn? How long ago did it happen? Things of that nature, because that's going to determine the level of treatment that you receive or that individual receives. It is important that we are being mindful of things. And I know there's a lot of internet providers, nurse practitioners, doctors, or people who say that they want to give medical advice. And that's all fine and then. And they may have gone and Googled or chat GPT'd or what have you. But you want to make sure that you're getting guidance and information from a licensed healthcare provider to make sure that you're staying safe and that you're getting the correct treatment. There's a lot of myths and a lot of coulda, shoulda, wouldas out on the internet and social media. So just make sure that you're getting the proper care that you need. Another thing that I want to talk about, and as a pet owner, I know my dogs, and when we had our cat is no longer with us now, but um, anytime there's thunder, there's lightning, and specifically fireworks, our dog, Lola, is just so nervous. She has a lot of anxiety. And I know a lot of individuals have pets. And so fireworks may trigger anxiety in many animals. And we see a high percentage of animals getting out, getting lost, running away because they're afraid. And we see the posts go up on social media. Anybody seen Tico, because Tico ran away. So make sure, one, that you're keeping your pets indoors and in a place where they are secure. Keep the pets in areas where you can keep the curtains drawn. Play calming music or white noise that may help drown out the noise of the fireworks. Create a cozy and safe space for them. I know my dog likes to go in the closet or certain areas like that. If they have a playpen or a crate, that you can create a cozy environment for them where they feel safe. My dog also likes to go in the garage for some reason. I guess she feels safe there. And don't bring your animals to fireworks shows, especially if you have an animal that is very nervous or one that deals with anxiety when there's crowds or loud noises. And then you can also use vet-approved calming aids or pressure vests. We have a thunder vest for our dog Lola, and it tends to provide her with some comfort. But there are times, many times, whenever it's thundering really bad or raining, we have to provide her with something like Benadryl or things of that nature. We've talked to our vet about it. They've given us the instructions on how we utilize it for her. And some dogs actually have to have prescription medication for anxiety. Another thing I want to talk about, and we have to be mindful of that, is any individual who has PTSD, who's been in the military, who has experienced different traumas that were related to loud noises and things of that nature. We have to be mindful of that. So let's check on our family and friends, even our neighbors who we know are veterans and things of that nature and have potentially PTSD. Fireworks can cause these individuals to have anxiety and to deal with some, stressors during this time. And so what we want to do in terms of our animals is we don't want to yell at them or scold them if they're frightened. They're frightened, right? We want to make sure that we are providing them with the comfort that they need, as well as, and I'm talking about pets, but I'm also talking about vets, our veterinarians, our veterans, and our family members and neighbors who have dealt with, again, PTSD. We want to be there for them, comfort them, provide them with, um, I can't think of the word, comfort, and just make sure they know that they have somebody who's there with them. And don't leave your animals outside and in the car. Um, it's hot in Florida, and we don't want to leave anybody in the car, whether it's our animals or children or babies. We are seeing increase in numbers of child death, infant death from being left in hot cars. And I want to make sure that if you know of someone in your family that deals with PTSD and they struggle around the holidays, when it comes to those holidays where there's a lot of firework activity, be proactive about that. Get them the help that they need ahead of time. If they have to take medication or there's different teas and things of that nature, CBD oils and stuff like that, make sure you have that on hand and you start the routine beforehand. Start earlier in the day. We know fireworks are between a certain time. Well, it doesn't matter right now because we have people in our neighborhood setting off fireworks now. We early in the week. But anyway, be proactive, right? And don't wait until the last minute to try and help that individual or your pet. Make sure that if they suffer with anxiety, that you're having those conversations with your healthcare provider and your veterinarians to ensure that you have the medication and things on board. The next topic that I want to talk about, and you all know, anytime we get together, it's going to involve food and cooking food and gathering, right? When we think about food, and I just laughed a little bit because there's a running joke: who cooked it, right? When someone's coming to the cookout and they're bringing food, we want to know who cooked the food, right? And the holidays is not a time to start experimenting with different recipes. I'll say that. And if you never bring anything to the cookout and you haven't cooked anything, you're still trying to figure out how to cook, bring the paper goods or some soda or some dessert, things of that nature. I'm joking, but it's just a running joke in my family, and I'm sure with many other families. When it comes to food safety, 1 in 6 Americans get food-borne illnesses every year. And that's from food that's undercooked, not prepared properly, that has sat out for too long, was not stored properly, or leftovers that have been left in the refrigerator for 2 weeks and people are still trying to eat on it. Many outbreaks happen in the summer due to outdoor cooking and improper food handling, as I mentioned earlier. Some of the things that we can do for food safety tips is, one, making sure that we're washing our hands, washing the surfaces that we're cooking on, and then that we're washing our produce. Make sure that you have hand sanitizer available. Make sure you have the hand wipes available. Make sure that there is a place where people can go and wash their hands. It's a good thing to have soap and water available. If you're at home and you have a restroom that's designated for your guests when they come over, make sure you have hand soap and paper towels available for them. Also, we want to make sure that there's no cross-contamination between raw meat and other foods. So make sure that you're being careful when you're handling the food and when you're preparing the food. And then when it comes to cooking the food, you want to make sure that it's at the correct temperature. So when it comes to that, use of thermometers is good. Making sure your poultry is cooked at 165 degrees Fahrenheit, ground meats at 160, steaks and pork at 145 degrees. And then chill. Refrigerate leftovers within 2 hours or 1 hour if it's 90 degrees or more outside. So if it's 90 degrees or more, those leftovers need to go into the refrigerator within an hour, and 2 hours if it's less than 90 degrees. I'm going to already say it right now. We know it's probably 90 degrees outside at this moment. So make sure that if you have leftovers that they're being put in the refrigerator as quick as possible. When it comes to grilling, this is another source of burns and injuries during the summer months and around the holidays, because people want to grill, they want to get out there and hang out with their friends and show off their cooking skills. So make sure that you're cleaning your grill and make sure that it's never left unattended. I can remember we were watching a show and this kid was little kid, maybe 2 years old, had eaten a burger or something to that degree and developed some symptoms. They took him back and forth to the hospital, sharp pain, ear pain, inability to swallow, several trips back and forth to the emergency room, and they couldn't figure out what was going on with the kid. Final time to the emergency room, there was a paratonsillar abscess, which is behind the tonsils, and there was an abscess that was forming. And that could be pretty dangerous because it could cause the airway to swell up, different things of that nature. That child could have become septic and, been in bad shape. That child had to go to the emergency surgery in order to remove. Once they did the x-rays, they were able to see a piece of copper wire that came from the brush that was used to clean the grill. So just be mindful of that, right? You can have, and there's other things other than the copper wire that you can use to clean your grill, but make sure you're cleaning it, that you're using safe materials to clean, and that the grill is never left unattended. And if you have small children, make sure you're keeping them away from the grill and that you are tending the fire as well. If you're using propane tanks, making sure that there's a good connection and that you have inspected and checked your propane tank to make sure that it does not leak and that there's no potential issues there. One of the things that I want to just kind of wrap things up, I know I've talked about several different topics tonight, but as we move into the summer months, we're in the summer months. As we move into the times where we're out and having fun with friends and family, one thing I want to bring up: if you are sick, please stay home. Any fevers, chills, temperatures, you name it, signs and symptoms, runny nose, things of that nature, please stay home. We are seeing increases in COVID. We're seeing increases in flu numbers. And so if you are sick, please stay home. We don't want to spread. We don't want to bring the germs to everyone. You might have someone in the family who is immunocompromised. Their immune systems are weakened, and we don't want to bring the germs to those individuals. And wash your hands, stay hydrated, make sure that you're taking care of yourselves, because if you're not 100%, you can't take care of anybody else. I want to stress that you, one, know when to get help, when to seek care, and make sure that you're doing things that are make sure you're not doing things that are going to put others in danger, whether it's with fireworks, whether it's food, whether it's grilling, things of that nature. Be safe this holiday season. Be safe. If you or your family need care of any summer related injury or any health concern, reach out to us. Wells Legacy Health and Wellness, we are here for you. Call us, book your appointment online. Stay safe, stay well, and have a happy, healthy summer. This is Dr. Latoya Wells with Wells Legacy Health and Wellness. We have some exciting news. We are accepting insurance. We just put out a campaign on that. So if you know of someone that is in need of a primary care, we have early morning, evening, and weekend appointments. We also offer telehealth and in-home visits. So reach out to us, share the information, share our website with those that you know, share our social media pages with those that you know. I want to make sure that we're getting this information out to the community. I'm so grateful for you all who have already shared, who already commented, and who are referring your friends and family over to us. Until next time, be safe, stay safe and be well. This is Dr. Latoya Wells with Wells Legacy Health and Wellness. Have a great evening.